So we've been trying to address that. There are programs like the one at the University of Arizona that Andy Weil set up that train conventional physicians to be expert in unconventional modalities, and then they learn the other lexicons, and they can use the language of traditional Chinese medicine. We went the other way. So over the past 15 years, as we've been doing this clinical model, there's also been teaching involved. There's also been a lot of research. We've published quite a few papers. But we've been running an integrative medicine residency, but in our case, we're running it for naturopathic physicians. So we take graduates of naturopathic colleges, four-year colleges, and we teach them evidence-based integrative medicine. And one of the things I've been adamant about teaching them, Johan, is look, if you call up a conventionally trained rheumatologist or oncologist and you start talking about chi and energy fields, they're going to freak out and hang up on you. I mean, they just are. So in your heart, yeah, so you can believe all that, it's fine, but you've got to explain stuff in terms your colleagues are going to understand. So I teach them the language of conventional medicine, say translate. If it makes sense, it makes sense, and then all the rest is just how we describe things. So find a way to describe it so that your colleagues don't freak out, because if they freak out and stop listening to you, the patient loses. We have to be able to communicate. And so, yeah, I think that is a problem, but I think it's a fixable problem.
Yeah, and there's probably some flexibility on both ends is probably needed, and some movement. And
Yeah, no,
an open mind, basically.
Yeah, meet in the middle, ideally. Again, to be honest, here's one of those areas where the fact that I am a conventionally trained doc first, I much prefer a description in terms of neurophysiology than in terms of energy fields and cosmic karma and all of that. I mean, I get lost in that too. So, my colleagues and I, because we've been working so intimately together for 15 years, we can have a good laugh about it. But I say, come on, I got you, but give that to me in language that doesn't make my eyes glaze over. I mean, give me something I can hang on to here, and they do, and we do meet in the middle, and it's a healthy give and take. I think we can get there. I mean, I think once we all recognize we all have to be careful to exclude the charlatanism. There is stuff out there. There are false claims. There's stuff that doesn't work. We all have to care about that, whether conventionally trained or otherwise. And then, we all share a passion for using only legitimate things, but a wide array of legitimate things to help our patient. We'll sort out the language issues. I think we really will.